as I said, eyes is very important. This patient, how patient presents, patient is going to say that, doctor, I have got pain in my eyes, usually, and it has happened 2 weeks ago as well, but then I was fine. But this time I thought I should be coming here as well. Right? And then you ask other symptoms, you may get other one or two MS symptoms as well. And this patient is giving the history that my mother has got MS. So that is something going to be more towards MS. Plus, when you do the investigation or examination, general physical, vitals, eye examination for sure, because eye problem patient has got, there you will get something. What? Visual acuity is the plus RAPU. That is what they get. That is specific for your MS. Again, you're not saying you have MS. Again, what you're saying, I'm suspecting you have MS. Or you might be having a condition called multiple sclerosis. I'm going to confirm it by doing an investigation. Right? So that way you should be good. Okay, next. Who will do? So who did last? You did. So, and female candidate who has not been assigned a station for tomorrow. Those two are sitting at the back, relaxing. Anybody interested? Okay, please come. Right, so okay, let's do this one. You are FY doing the A&E. Patient is Olivia. Olivia Jones, age 64, has been brought to the hospital by her husband due to weakness on one side of the body, slurred speech, drooping of the angle of mouth, and difficulty in swallowing. Patient symptoms improved after 2 hours. Patient is completely fine now. What it is? Yes. So I have given you the diagnosis as TIA, transitive ischemic attack. Fine. Patient cannot remember what happened 2 hours ago. Blood pressure was recorded. It was 150/100. General examination and neurological examination has been done. No findings. Routine blood tests have been done. Results are awaited. So, after taking history, when you say, I would like to do some examination, I would like to send some investigation, don't say that. Say, I have done the examination, no finding. I have sent for the investigation, waiting for the result. So, change it accordingly. Talk to the husband, Oliver Jones, take history, discuss the management plan with him. Consent has been taken. Right? So, if you don't have consent, you can't discuss, but consent has been taken. So, don't worry about it. So, TIA, we know fast symptoms, we know like we can ask for loss of consciousness, dysphagia, and all those things. You know the risk factor for stroke, right? Stroke or TIA, we discussed modifiable, non-modifiable factors. We did discuss that. So, if you confirm it's TIA, what's the treatment? Aspirin. Aspirin is the first thing that we give straight away. Aspirin. What else? So yes, so remember two things. Number one is aspirin, second is specialist review. The patient, any patient coming to you with TIA must be seen by the specialist in how much time? In 24 hours. Yes. Within 24 hours, patient must be seen by the specialist. What specialist is going to do? Specialist might consider doing CT scan, might consider doing an MRI scan. Will definitely be doing an ECG. Will definitely be doing an echo. What is echo? Ultrasound of the heart, jelly scan of the heart. And we'll do the carotid Doppler. That is very important, right? So these are the things that specialist is going to do. So mainly aspirin specialist review. And then they might consider giving some other medications as well. Which medication? Statins maybe. Or maybe, I don't know, blood pressure is high. Please find it out if I'm having, or my wife is having high blood pressure or what. Or maybe it's first reading. I don't know. That's very time. So treatment is aspirin specialist treatment. Don't miss that out. And specialists, they might do the scans, they might do the CT MRI, they might do. All right. Okay, let's do it then. Start.
My name is Dr. Alinka. My GMC number is 12345.
How is she talking?
Okay. Miss is doing, she's in our hands right now. She's in safe hands. So I just wanted to ask you a couple of questions about her. How
Is she fine now?
Right now, she is under our care right now, and we are just evaluating her. And I have just I've just examined her, and we've done some tests. So I just like to ask you a couple of questions about how she ended up in this condition, and then I can inform you about her diagnosis. Is that okay? All right. So, could you tell me how you found her? Like, what was the problem when it started?
Yeah, this morning we were preparing breakfast, and everything was fine. We're talking to each other, everything was going well. And suddenly, what she was saying was not easily understandable for me. And she was having weakness of left side of her body.